Good morning and welcome to Meet the Experts, Adolescent and Young Adult Edition. My name is Cassandra and I'm a patient and family specialist here in the Patient Librarian Welcome Center. We present these AYA sessions on a Tuesday or Wednesday once a month, and today's topic is navigating body image and self-worth as a young adult patient. And before we start, we have a quick disclaimer. The content in this presentation is not medical in nature, and the viewers should consult their physician should they have any questions. If you think you may have a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because you watched this presentation. And now it's my pleasure to introduce our speakers today. Dr. Charlotte O'Leary, who is an assistant member, supportive care medicine, and Jessica Latchman, an advanced practice registered nurse specializing in palliative medicine, both from Moffitt Cancer Center's Department of Supportive Care Medicine. Welcome, Dr. O'Leary and Jessica.
So we'll start today. Our topic today is talking about navigating body image and self-worth as a young adult patient.
So some of our objectives today will be, we're just going to introduce the topic. We're going to talk about physical impacts of cancer therapies, the psychosocial impacts of those therapies, and how we can better cope with them.
So there's been multiple studies that looked into body image, and the definition seems to span through all these studies, where body image is a complex and multifaceted term commonly defined as the subjective perceptions, views, and thoughts of an individual's own physical appearance.
All right, so cancer and body image, right? So we know that cancer therapies just don't affect our physical health, but also our emotional and psychosocial well-being. So these changes in turn, with all the treatments, whether it's the radiation, whether it's the surgeries our patients go through, they can all have an overall impact on well-being and quality of life. Most studies regarding body image has been done on breast cancer patients. It's one of those populations where they have a lot of funding. Few studies have investigated like body dysmorphia or body image issues in different types of cancers and in men. So most of the studies are done with a more female population. And honestly, I feel like body image is sometimes an overlooked aspect of cancer therapy and the treatments we use. Because, most of us think, we cure the cancer, we've done the job, right? But it does affect patients emotionally and psychologically.
In 2022, Henry and colleagues demonstrated that more than over 19 million new cancer diagnoses with an estimated of 10 million deaths occurred in 2020. New cancer treatments have led to an increased life expectancy for many patients. And as Jessica emphasized, yes, surviving cancer is important, but then the scars we have, and a lot of them are visible to other people, are noted. Cancer treatments may lead to the loss of body parts, scarring, like I mentioned, hair loss, disfigurement, weight changes, and even functional limitations that can affect a patient's self-perceptions and lead to body image disturbance. And a lot of these days, with social media being so influential, body image is overemphasized as well, right? You see people on social media with filters in place, and that leaves a lot of people, particularly patients, vulnerable to their scars that are visible to everyone.
So we're going to talk about a little bit about the physical impacts of cancer-directed therapy. Dr. O'Leary kind of touched on some of these already. So one of the biggest side effects is hair loss, and chemotherapy and radiation can both cause hair loss. And not so much the immunotherapy and bispecifics anymore that we're using. But the physical loss of hair definitely is a reminder and is distressing to our patients, right, of their cancer and the cancer diagnosis and what they're going through. A lot of our cancer treatment, it not only affects the bad cells, but it affects the good cells as well. And it actually causes a lot of weight fluctuations. So a lot of our patients, and end up with what we call cancer cachexia, anorexia. And it's really like they just can't maintain their weight because of the treatments they're undergoing.
And then sometimes you'll even see patients gain weight, the other spectrum because of chronic steroid use. And that also, in addition, causes a lot of distressing symptoms for a lot of people.
Yeah. And so then, we talk about body changes and surgeries. Our goal now is to prevent cancer. And sometimes, when we look at surgeries, a lot of surgeries are used for curative means. So, especially with patients with breast cancer surgeries and, head and neck cancers, which, like Dr. Leary is very visible to everyone around us. It's very like psychologically, like deterring for patients because they have all these scars that is very visible to everybody, including themselves, especially when they look at themselves in the mirror. So we have to be cognizant of all these things, right? A lot of patients, they end up with like skin changes, especially from radiation and chemotherapy. We see a lot of, when they go into radiation, they have like skin desquamation, and they have like just like skin color changes, which causes drying, rashes, pigmentation changes. And those are all just as important and can be psychologically devastating to patients.
There's a lot of psychosocial impacts of cancer therapies. A lot of us tie our identity to our appearance and how we look. And because of the physical changes due to cancer itself or the treatments, it can profoundly affect how patients with cancer view themselves. So like I mentioned, loss of identity, the loss of hair, the fluctuations in weight, reduced self-esteem, feeling less attractive or physically diminished can affect how you feel about yourself, make you feel lower your self-worth. And this leads to things like social withdrawal, right? You're embarrassed or more self-conscious about your appearance. And so you don't want to go out in public. You don't want to spend time with friends and family like you used to. And then you start isolating yourself socially, not purposefully, right? Sometimes this could be subconsciously done, but because you're worried about how you look or how other people are going to perceive you or judge you, you tend to not go out as frequently. And then the big thing is a lot of patients start feeling more depressed and anxious because their body image has changed, and it increases, our mental health concerns. We are nervous to go out in public because people are going to ask us or look at us differently. And these are the times when we need to like focus on ourselves and try to use that internal strength to be like, I'm strong. This is not the only thing that I am worth. It's not just my physical appearance. It's me, my internal appearance that you need to also focus on.
And I think a big component of this too is, when we're anxious or we're depressed, when we don't feel that love in ourselves, sometimes I think that affects how we tolerate treatments. So this impacts like the whole picture of the cancer journey. So I think it's very important that, when patients feel this way, we need to find ways in which to cope. So this kind of brings us to how do we manage these changes, right? So definitely one thing that's always helpful, it doesn't matter what you're going through, whether it's cancer or not cancer, is just kind of talking to other people. Just letting people know how you feel sometimes make you feel better, right? At Moffitt, we do have, I think, some social workers and our yoga therapist here that does like online Zoom classes to help with mindfulness, relaxation, breathing exercises. Those are all like great coping mechanisms, right? Like when we feel anxious, we can deep breathe or just be mindful of the fact that we're feeling anxious to help us get through things. There's a lot of support organizations out there, and just kind of getting yourself embedded into one of them that you feel very comfortable in, and discussing, your fears, your anxieties. I think all those things are very helpful, right? And just, like Dr. Larry was saying, sometimes we have to like face our fears, right? And actually talking about it, actually internalizing that you have that fear, is a big part of helping you move forward. We do have psychologists here that do cognitive behavioral therapy. And obviously, if you're in that boat and you feel like you need mental health therapy, we definitely recommend that you talk to your oncologist. We do have a behavioral medicine program here at Moffitt that kind of helps with those things. Or you can find somebody on the outside. You just call your insurance companies. Some insurance companies kind of let you know, like, these are the folks we cover, and you can reach out to those. And sometimes it's just finding that therapist that you click with, to help you through these things. Because I feel like when you have rapport and trust with somebody, therapy tends to be a lot better.
And interesting enough, on a side note, some therapists have gone through what you have gone through or are going through. And so connecting with somebody who is specialized in cancer treatment may be helpful for you as well. Managing reactions to others, I tend to say, how do you react to people? Be assertive, face these situations with confidence instead of avoidance. It's easier said than done. And sometimes you have to build yourself in small trials of going out and building that confidence, but eventually you will succeed. These times can help you when you go out. People are going to ask you awkward questions. People are going to look at you differently. And so it'll help you prepare different responses. And, you can respond any way you would like. You don't have to, tell them, or you can be open, it's on that person. It's not on you.
Yeah, and I think a lot of this is just like doing this repeatedly. It just makes it more comfortable for you. So definitely just is practicing, just saying these things more frequently. It just becomes second nature, right?
And there are TED Talks about things like this, not cancer specific, but like fake it till you make it.
Yeah.
Just get out there and be your genuine self. And with time, it will become easier. And if a question is awkward for you, just tell them, I'm fine. Thank you for asking. You don't have to answer anything you feel uncomfortable with. And the last point here says you could just ignore them. That's appropriate as well.
And you could just say, I just don't want to answer. It's okay too to say that, I think. It's just like you're not comfortable answering that question. It's okay.
So this next slide just kind of mentions everything we mentioned previously.
Yeah, and sometimes, looking at your scars differently too, I think kind of helps, right? Knowing that, we talk about, when you have scars, it's like your warrior scars. You've been through this, somebody else hasn't, right? So just being proud of the fact that you were able to make that decision for your health. And this is the consequence you have. That makes you a better person, a stronger person, because you had the will and the courage to go through with it.
And something that people are doing these days are getting tattoos over certain scars to demonstrate, like, I'm strong, this is who I am. And often those tattoos are artistic, and there's been a lot of tattoo parlors that are specific to cancer patients to show and embrace what you're going through. Remember to look at yourself as a whole person too, right? This is just part of you. This is not who you are. And I know going through your journey, sometimes it does feel like this is how I feel and the only thing I am, but you're not. You're more than that. And feel those feelings, right? That's where being graceful to yourself and accepting things is okay. Journaling is really important as well. If you enjoy writing, and even if you don't, just writing those moments, those feelings down, and then looking back at sometimes at those journal documents and saying, look how far I've come.
Yeah, I think you're more appreciative of yourself when you look back on all the things you have struggled trying to overcome. So I think, even for like, even if you don't think about cancer and you look at all the therapies that we use for kids, journaling is a big part of that. And just like journal on your journey, makes you a better person.
And surround yourself with those that encourage and support you. Find your cheerleaders, find your friends that are going to be on your side no matter what. And, even work with them if they're around you when you go out and someone asks one of those awkward questions. Let them have responses for you. Let them be, your support system and your cheerleader.
Thank you for viewing this session. We offer live adolescent and young adult Meet the Experts sessions through Zoom. And to view a list of upcoming sessions, please visit moffitt.org/meet the experts or call 813-745-1690.